Welcome to the Do No Harm podcast, where we discuss the battle to keep politics out of medicine. With our hosts, Dr. Marilyn Singleton and Do No Harm's founder, Dr. Stanley Goldfarb. Together, we're talking with people to create a better healthcare system for all. One that's based on medicine, not division.
Hello, this is Dr. Marilyn Singleton. While European countries are pulling back from so-called gender-affirming care, America continues to push forward. Our guest today, Dr. Roy Eappen, wants to know why America is moving in the wrong direction and why it hasn't caught up with the science. Remember, follow the science. Dr. Eappen is an endocrinologist certified by the Royal College of Physicians in Canada, a fellow of the American College of Endocrinology, and a fellow of the American College of Physicians. He is an assistant professor of medicine at McGill University, and he has been treating patients for over 30 years. Dr. Eappen has been a member of the Endocrine Society and believes the organization has done vital work in many areas of public health, but on the topic of gender-affirming care, he believes they are wrong and that mental and physical health of American children is now at risk. Welcome to the show, Dr. Roy Eappen.
Oh, thanks for having me on.
Well, let me just start with something really basic, just for the folks out there can know. What is an endocrinologist and what kind of patients do you see and what do you do with them when you see them?
So endocrinology is a subspecialty of internal medicine. So it is medicine for adults. And endocrinology, basically a study of hormones. So a hormone is a substance produced at one site in the body and acts on another site in the body. So many examples of that. So the thyroid, the pancreas, which releases insulin, the thyroid that releases thyroid hormone. So I see mostly people with diabetes because I'm a general endocrinologist, so that's probably my most common. But I see people with all kinds of things, including people who want to transition for their gender. Though I see much less of that these days. And I'm an adult doctor, so I don't see children.
Okay, well, I'm going to let Dr. Goldfarb kind of take over after that, and thank you for that explanation.
Hi, Dr. Eappen. How are you? Stan Goldfarb here. Dr. Eappen is one of the senior fellows of Do No Harms and has been a wonderful partner in many of the activities that we've been engaged in. Roy, tell us a little bit about the status of gender care in Canada. Are there improvements compared to what's going on in the United States? Is it a different entity? Just what's your sense of that?
I would say it's probably worse because it's pretty much all affirming care. They seem to be listening to the latest recommendations of WPATH 8, which are like no limits as to who can be treated at whatever age. So I think, at least in the United States, there are certain states which are saying, yeah, let's have a second look at that. In Canada, a few of the provinces are beginning to make those kind of statements, but mostly at the school level, not so much as at the medical level. So both Saskatchewan and New Brunswick have made comments about not allowing schools to hide the gender transition of students from their parents. So, I guess that's a first step. But I think the Americans are ahead of us on that, and the Europeans are way ahead of both of us on all of this.
The first time I met you, Roy, was in New Brunswick with a group of physicians who were concerned about many of these issues in healthcare, particularly the DEI regimen, diversity, equity, inclusion regimen. What's going on now in Canada vis-a-vis the physician organizations? Are they in support of focus on diversity as opposed to meritocracy and this willingness to have children go through gender-affirming care?
The Royal College of Physicians, which is the organization which has certified me and certifies all of our specialists in in Canada has a suggested DEI focus on teaching coming up. It's not finalized, but they have said that the statement that they put out for comment basically said that they wanted DEI to be embedded in every aspect of teaching and to be more important than clinical knowledge, which many of my colleagues and myself think is sort of bad for medicine, bad for our patients, and bad for doctors. So unfortunately, that seems to be the thinking among our colleges as well. Our colleges are the organizations that are the licensing bodies. So a similar statement has been released by the Ontario College of Physicians. And I'm sure that other colleges will release such statements too. This has happened in the law societies here, that you have to, in order to be certified as a lawyer in Ontario, you have to make a statement saying you believe in all this stuff, which is compelled speech, which I find abhorrent.
So it sounds like things are as bad there as they are here with regards to the organizational aspects of medicine. How about the individual physicians? Do you think this is highly accepted by the so-called rank and file physicians who are out there caring for patients, or are they suppressed in their speech the way we find here in the United States?
Very much the latter, because a lot of my friends and I were that conference that you attended virtually in Nova Scotia. We're talking about free speech in medicine, and the colleges basically don't want you to disagree with what they say or what the regulators say. And I think a lot of people are afraid to make comments. Even I'm a little afraid to make comments, and I have a big mouth. The real doctors who are on the ground on these issues, I don't think agree with this. And in fact, the Royal College apparently got 7,000 comments on their DEI proposed statement. They put out a statement today about it, saying that they thought that a lot of people didn't understand what was written. Sorry to tell them that I and many of my colleagues are able to read. And so they seem to say that we didn't understand what they were trying to say, and they're going to try and clarify it. But they're going to look at these 7,000 comments, many of which I'm sure were quite negative on that particular initiative. I think a lot of doctors disagree and are afraid to speak up, and I think that's same in the gender space. I spoke to several of my endocrinology colleagues about gender transition with hormones and surgery with children, and many of them were very troubled. In fact, that we went to the Endocrine Society and talked to many physicians who were troubled by this and didn't really want to say anything out loud about it.
Yeah, that was going to be one of the points we wanted to discuss about your experience at the Endocrine Society. Why don't you tell us a little bit more what that was like? Because as my understanding was, you set up a booth there along with other Do No Harm members and staff, and created quite a stir.
Yeah, it was actually quite interesting. I was, I had suggested we do that when I first met you, and I thought it was impossible to do it, but your organization is pretty amazing. They managed to get a spot in the area where there are many booths, and there's several of us who were there, and we just spoke to people. We called them over. We had signs. We brought someone who had detransitioned, Chloe Cole, who I thought was the most effective of us in speaking to people, because a lot of the doctors were saying, no, this doesn't happen to children. We don't medicalize children. It only happens to adults. And Chloe was telling them about her story, where she had a mastectomy when she was 14 or 15 years old, and her regrets and what she thought about all this. And we spoke to many physicians, many from other countries who agreed with us, and very few hostile comments, I must say. I think everyone was quite collegial. From that experience, my colleague Ian Kingsbury from Do No Harm and I wrote an op-ed in the Wall Street Journal saying, that maybe What we really wanted is that the Endocrine Society should reevaluate its guidelines for gender transition in children, guidelines that have not been revised since 2017. And our article in the Wall Street Journal sort of pointed that out. And interestingly enough, the president of the Endocrine Society decided to answer us in the Wall Street Journal and basically said that we didn't know what we were talking about. And he didn't mention that he had sort of a conflict of interest in this issue and that he runs a couple of gender clinics at the University of Rochester. And then we replied to him. The Wall Street Journal was very kind and let us reply to him saying, giving the evidence that there had been systematic reviews in European countries that basically say that there doesn't seem to be any benefit, and since there can be harm, we shouldn't be doing this, and we should basically be doing more talk therapy in this area and less medical therapy. And then, interestingly, after all of that, 21 endocrinologists from around the world wrote an op-ed in the Wall Street Journal saying that, indeed, the rest of the world was moving on from Dr. Hamas's position, who was the president of the Endocrine Society at that point, and that talk therapy probably is the best way to go.
Well, Doctor, playing the devil's advocate here for a moment, it looks like the Endocrine Society says that having gender-affirming care improves the well-being of gender-diverse people, their term, and it reduces the risk of suicide. And we've heard this meme, would you rather have a live boy or a dead girl? What is wrong with this philosophy? And what does the data show?
So, in fact, if you speak to Chloe Cole, who was one of the so-called detransitioners, they said that to her parents, and that was one of the reasons she went on with this. There's really no good evidence to show that this is true, that there's the numbers of suicides are low, and there's no evidence that there's less of it afterwards than before. There have been a couple of studies trying to show that there was some benefit in terms of psychological response, but there are other studies. I mean, I've seen studies that show that use of antidepressants and antipsychotics after transition was higher than before transition. I don't think that there's actually good evidence to say those kind of comments. And those comments are somewhat, I find them dangerous in that you're really threatening parents in a way that doesn't really amount to informed consent. And informed consent is actually very important. And I think by threatening parents in that way, you are removing informed consent.
Roy, let me ask you just to slightly switch the focus here, but only slightly, is you wrote a really important piece in the Wall Street Journal, again, you're very prolific there, about the issue of the relationship between so-called gender-affirming care and the gay and lesbian community. Can you comment about what you wrote in that article and how you view this particular issue?
If you look at the numbers, we don't seem to follow people long enough. We don't seem to follow up. A lot of children and adults follow up, and I think we should do following to see what's going on, because we want what's best for people. We want what's best for our patients, and we want what's best for children. You just follow them. In 80 or 90% of the cases, they get over the gender dysphoria. Puberty itself seems to be what makes them get over gender dysphoria. And if you look at who have gotten over the gender dysphoria, a large number are same-sex attracted. The number I saw quoted in boys is about 2/3. If you're going to do anything before that they've gotten over the gender dysphoria, aren't you actually doing conversion therapy on what are essentially gay kids? And that was my point. We did it on the 50th anniversary of the American Psychiatry Association's changing the definition of homosexuality as a mental disorder. So that was what we wrote, what I wrote in that article, and I believe it. I think that watchful waiting is the best way to go, because a lot of these kids will end up being gay, and maybe we should just let them. Because, I think we accept that being gay is a perfectly reasonable way of being. And why should we medicalize people that would go on to be perfectly normal otherwise?
It's interesting you bring up this whole concept of conversion therapy. Out in California, New Jersey, and several other states have banned so-called conversion therapy for minors. And this is psychological or ministry or some type of therapy that tries to convert people from being gay to being straight. And it just seems so odd to me. If that's wrong, why isn't this new transgender activism just as wrong? How do you feel about that?
I think people are being very political about these things. I mean, we have the same law in Canada. The federal parliament passed a law saying that you can't do conversion therapy, and that seems to include transgender people. But, I think we have to be careful in how we define things. This seems to be political virtue signaling rather than actually looking at what's in the best interest of the child.
Roy, I think you've been a real hero in this space. I must say, you've spoken out really eloquently about these issues. And as Dr. Singleton pointed out in the beginning, you speak from the point of view of an endocrinologist. So it's not like many of us are physicians, but we're not really we don't have experience in this particular area, and we're talking about it from what we've read and what we've spoken to with our colleagues. But you talk about it from personal experience, and I think that's been extremely powerful, and I think this will be very helpful to our listeners, your perspective on all this. So I really applaud what you've been up to so far, and hope that you continue in a really energetic way to be part of our organization and to speak out the way you have.
Well, thank you very much. I wanted to mention a thing that has happened in the last few days. The World Health Organization, yesterday, they commented that they will not be publishing gender guidelines for children or adolescents because the evidence is very weak. So they won't be having gender guidelines. So I find it interesting that the World Health Organization is also saying that. So maybe Americans should consider that as well. And Canadians, of course.
Great.
And thank you for that information. Thank you again for coming on the show. All I can say is we need more courageous and rational voices like you out there in medicine. After all, it's all about the patients and their safety and health. And I'd like to thank everybody for listening, and thank you for supporting our efforts to protect patients, protect doctors, and healthcare itself from divisive ideology. Please visit us at donoharmmedicine.org. Thanks again for listening.